Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's COVID briefing. Joining us today, the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. The pandemic continues to make a mess of things across the province, including almost 400 new cases today. And almost 300 yesterday. This week we've reported the highest case numbers we've seen during the pandemic. Nova Scotians, we're not used to high case numbers and we don't like them. But the reality is that the case numbers will continue to stay high. We expect to see sustained high case counts over the coming days for sure. The sheer volume of cases is putting incredible pressure on public health and also on our dedicated lab professionals. They are doing amazing work under extraordinary circumstances, and I want to thank each and every one of them. We were all hoping that theirs and our holiday break would look differently. Everyone looks forward to a break over the holidays, and I feel for our healthcare workers in particular. They really need a break. But as we've seen with this pandemic, things can change very quickly. We're seeing workforce impact. We're seeing the workforce impact of the broad transmission. We're seeing that in education. We're seeing that in healthcare. We're seeing that in our small businesses. The impact is very real. To slow the spread, we have to individually slow down. I know it's the holiday season, but we really need to slow down. It's that simple. It's time for each of us to step up and take more personal responsibility for protecting ourselves and protecting our family. So we're asking you to be even more vigilant. If you're sick, isolate and get tested. And if you find out you have COVID or you're a close contact, do what public health advises. If you are positive, then inform your own close contacts. We're all tired of COVID, but it's here. And it's spreading rapidly across the province. So far, I believe it's fair to say the symptoms appear less severe than previous variants, but it's still COVID. And I hear that there are those who still think that COVID is a conspiracy. They're vocal on social media, but here in the real world, we must stay focused on protecting Nova Scotians. Even if the symptoms of this variant do happen to be less severe, think how your elderly parents, your grandparents or neighbors would manage, or the immunocompromised, or the very young. Think about what would happen if things changed and people started to get hospitalized, or if record numbers of healthcare workers, paramedics, or police started to get sick and had to isolate. Think of all these things and be smart. It's up to all of us to protect the most vulnerable among us, and to protect our healthcare system. I know that this is where most people's minds and thoughts are, and that they don't need to be reminded. But as you move around, realize that there are tens of thousands of Nova Scotians who are watching the calendar, are counting the days and hours and wondering if they were exposed. They are replaying in their mind, how close was I to so-and-so? Did I see so-and-so over the last couple days? It's torture and it's mentally exhausting. And then if they do test positive, it's another level of anxiety. Did I pass COVID to a loved one, to a friend? I mean, these are the things that are happening around the province for tens of thousands of Nova Scotians, and this is a very, very painful mental exercise. I know this firsthand. I can tell you that I've been doing a lot of calendar watching and clock watching this week, as I myself was at an event last week where people have since tested positive. I do not have COVID, but I certainly understand the pressure of awaiting results while thinking of those that I had been around in the days preceding, including my own parents and in-laws and family. So I have personally closed my social circle, and I'm focused on working with and supporting public health as we as a province work through this. So that said, I have little patience for those who are dismissive, because, but I also know that for each of them, there are many, many more Nova Scotians dealing with the mental impact of COVID. And I can assure you that even if the physical symptoms are less severe from this variant, the mental anxiety of COVID in general is not less severe. So I urge you, slow down, limit the chances that you will find yourself in the situation of calendar watching and clock watching. We know that the pandemic has been challenging for everyone, and certainly for our many businesses across the province. The latest restrictions we announced on Monday will have a significant impact on many businesses during what would typically be a very busy, happy time of year. We've listened to the businesses. We've spoken with many businesses. We see the need and we want to help. So we're announcing today the Sector Impact Support Program. This program will direct assistance to the businesses most impacted by the latest restrictions in the form of a one-time grant up to $7,500. We expect and we hope that this will help small business owners like restaurants, bars, gyms, and recreational facilities. There'll be a full list, and the criteria will be promoted widely over the next couple of days. But we need to also understand that no two businesses are the same. So in order to be more flexible, the program has different tiers of grants that are based on payroll. Anywhere from $2,500 to $5,000 or $7,500 will be the grants that will be available. I know in the past, funding from these types of programs hasn't come fast enough, and we're working both internally and with Dalhousie in the hopes of speeding things up this time around. The pandemic is not over. And as we go forward, we will work with the business sector to be flexible and to understand the ongoing impacts on their operations, and we will support them. In closing, I've been asked many times about the enforcement investigation into the situation at St. FX. I can tell you that this morning, 2 summary offense tickets, both in the amount of $11,622.50, which is the maximum penalty, were issued to St. FX and the St. FX Student Union for failing to comply with Dr. Strang's order. The offenses stem from the failure to comply specifically with the masking requirements. So there's a lot going on. It's a heavy time in this province, but we will get through this. Dr. Strang, over to you.
Thank you, Premier, and good afternoon, everybody. At this joyous time of the year, I wish I had better news, but I do need to be honest. I told you Monday to prepare for things to get worse before they get better, and unfortunately, they are. We've had a week of record high case numbers. People are worried, and I understand that. We're in a tough situation and will be for a while. We're in the midst of an Omicron wave, and there are still also cases of the Delta variant. The case numbers likely aren't reflective of just how much disease we have. Omicron is spreading faster and easier than any other variant. Thankfully, what we're seeing so far and elsewhere in Canada is relatively mild disease. We've only had 2 new hospitalizations so far, despite the high number of cases. There are a lot of unknowns about this variant and the concerns that the vaccines aren't doing their job. But the evidence and experience to date is showing that people who are fully vaccinated remain with good protection, especially against severe disease. Vaccine is a critically important layer of protection. We also know that an additional dose is necessary for those who have conditions or are on certain medications that significantly impact their immune system, or those who have less robust immune systems because of their age. And we also need to make sure that we get vulnerable populations like children 5 to 11 and newcomers with their first and second doses as well. Booster doses for all frontline healthcare workers are also critical, given this variant is more transmissible and they care for people who are sick. Almost all of our vaccine appointments for December are booked, and we are adding additional appointments all the time. And we expect to have a significant number of appointments opening up for January. And we continue to work to maximize all of our capacity to keep vaccine flowing as quickly as possible. I know that people younger than 60 are eager for a booster dose. Different provinces are taking different approaches when it comes to boosters. We will continue to follow recommendations from the National Advisory Committee on Immunization as we have done throughout this pandemic. We're focused on getting boosters into the arms of older Nova Scotians who are most vulnerable, those with chronic conditions and healthcare workers, and getting younger children and others vaccinated with their primary series. And as soon as we can, we will reduce the eligible age group so more people can receive their booster dose. We also need to continue with and strengthen some of our public health measures. We're adding extra layers of safety with stronger masking rules, and physical distancing and gathering limits are back in effect as of 9 o'clock this morning. I know it may be hard to understand why we need restrictions if we're seeing mostly relatively mild illness. But to be clear, mild illness just means we aren't seeing people in hospital or the ICU. It doesn't mean that people aren't sick. And as the Premier referenced, there's a lot of mental health issues around being a case or even a contact. When people are sick or they have been exposed to COVID, they can't go to work or care for children or their loved ones. So it's easy to see the ripple effect of an even so-called mild illness. And that impact becomes greater if the people affected are nurses, paramedics, police officers, firefighters, and others who work in areas that we need to keep functioning. We also have to think about the people around us who are more at risk, our grandparents, those who are immune compromised, and young children who can't get vaccine or who have only had the opportunity to get one dose. It's our obligation to protect them. And also, we don't know enough about the Omicron variant to just let it spread unchecked. We need some extra layers of protection in place while we learn more about this variant and get more people vaccinated with their primary series and boosters. I firmly believe that what we have in place is the right balance to help slow us all down and protect those most at risk. We know that restrictions have their own set of significant impacts. And so we are watching closely and will adjust as necessary. If we need to go further, or if it looks like we can loosen up, we will. For almost 2 years, we've announced case numbers almost every day. People use those to judge how good or bad we're doing against the virus. High case numbers, unfortunately, scare people. Omicron is pushing us to our limits. Public health reached capacity several days ago, and now our testing program and the lab have also reached capacity. The assessment centers are again running 7 days a week, and the lab has suspended some other types of routine testing. It's still not enough. We are past the point of full control of this variant. We need to change how we manage and respond. We need to focus much more on severe illness and less on the overall numbers of cases and infections. There is going to be a lot of COVID and a lot of spread. It is inevitable. But we can limit the impact of Omicron by focusing our resources in the health system on limiting severe disease. And that means directing testing and vaccine to those who are most vulnerable and most at risk. As long as we have limited amounts of severe illness, we can be more comfortable with high cases and a fair degree of community spread. We're planning now, and we'll have more details to share next week. But I can tell you today that it will mean changes to who and how we test, just like we have already shifted the way cases and our contacts are managed. but we also need the help of every Nova Scotian. It's going to mean many of you who are positive will have to self-manage your case without hands-on support from public health. Right now, the best we can do is to make initial contact and make sure you have the information you need to protect yourself and others. It's not ideal, and I don't want Nova Scotians to think that we're giving up on them or we're giving in to COVID. We haven't. We are changing our response to deal with Omicron. If you know you have COVID, we need you to identify and notify all of your close contacts. And a close contact is anyone who's been exposed to someone who has tested positive for COVID-19 while that person was infectious. And if people are infectious 48 hours before they get a test or develop symptoms. And close contact means you were within 6 feet of a person for at least 15 minutes while indoors, that you care for that person at home, you shared cutlery or dishes with the person coughed or sneezed on you or near you, and the person was close enough to have touched, hugged, or kissed you. All of those, if you've had those exposures to somebody who's a case, mean that you are now a close contact. And if you have symptoms, you need to start isolating immediately and book a test. Do not contribute to the spread by thinking you may just have the sniffles or a cold. Right now, if you have cough, fever, sore throat, runny nose, you have to assume that you have Omicron. And if you know you are a close contact, start isolating immediately away from others. Wait for 72 hours and then get a test. And if you need a test, be prepared to wait to get that test and then wait for your results before you come out of isolation or start having close contact with others. This is our reality at the moment. I'm also asking businesses and employers around the province for your help. I know that restrictions and being short-staffed is extremely difficult, but please support your employees in following the directions that I've just outlined if they have COVID or if they are a close contact. Aside from protecting your community, you don't want Omicron in your workplace. Our situation is serious, but it is not dire. We're going to have to make some tough decisions about our next steps, and we're going to have to ask even more of Nova Scotians and the people on the front lines working to keep us all safe. We will have more to say next week especially around testing, but in the meantime, I know that Nova Scotians will step up and do what we're asking. You have continued to meet every challenge COVID has thrown at us for the past 21 months, and I have every confidence that you will do so again. This pandemic has been a long road. We are all tired, and we have some difficult days ahead of us. I want to thank everyone from the bottom of my heart for all you have done and will continue to do. To businesses and employers for continuing to be part of the solution, no matter how hard it has been on your livelihood. To people working in the lab and public health and the public health teams managing cases. To volunteers who have put tests together and are handing them out at the airport and at pop-ups, the warehouse team who are receiving and shipping, chambers of commerce and regional enterprise networks, and the many workplaces, family resource centers, and libraries distributing rapid test kits. To immunizers, the public health nurses, pharmacists, and others who are working incredibly hard to get vaccines into arms as quickly as possible. And to screeners and vaccine checkers who are trying to keep sport facilities, events, healthcare facilities, and other public places safe and healthy. And to cleaners in healthcare facilities, workplaces, schools, and offices. And to my many unseen colleagues working in Department of Health and Wellness and across government to support the COVID response and adapt many other policies and programs. I thank all of them, but most of all, I want to thank Nova Scotians who have sacrificed so much to this pandemic and continue to come together every time a new obstacle is thrown in our path. The timing of Omicron could not be worse. It is placing a major damper on our holiday spirit. However, I continue to be reminded how lucky we are to live in this province. Time and again throughout this pandemic, Nova Scotians have shown up to support one another, to care for one another, and to show love for one another. This support, caring, and love is the core of the holiday season. We can do this. Tina.
Thank you, Dr. Strang. Just a reminder, we'll take one question and follow-up from reporters on the phone in the allotted time that we have for today's briefing. We do have a fair number of reporters on the line. We have 17 reporters, so we will take as many questions as we possibly can. We will start with Heidi Petracek from CTV. Go ahead, Heidi.
Thank you. Rapid test take-home kits are flying out the doors. Do we have enough to kind of keep that pace up moving forward?
We're working to procure our more rapid test kits and get as much as we can. Part of what we'll be talking about in more detail next week is how we may adjust how we use those rapid test kits to make sure that those who are it's most important that get a test are tested.
Go ahead, Heidi, with your follow-up.
Thank you. When you talk about public health, maybe stepping back a bit from managing cases of COVID, how will they keep an eye on those who may develop serious COVID symptoms? So if someone is diagnosed, you talked about notifying your own close contacts and things like that, but how will you keep track of, who gets severely ill so that we know there's not people at home kind of suffering when they really should go to the hospital?
So when we first contact people from public health, they are given information about symptoms to watch for and what to be concerned about if what for getting worsening. We also have the Nova Scotia Health Authority and in partnership with IWK do have teams of people that are checking in different ways, whether by phone or by virtually, and supporting people who, especially those who are more at risk for developing severe disease, and doing some virtual, if you will, monitoring of individuals and supporting them. And so if people who are showing signs of worsening illness are identified quickly.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. I'm just wondering if people will be essentially left more to their own devices if they test positive. Do you still have the people you need to continue to advertise exposure sites? Because not everyone would know when they were at least 15 minutes in close contact with somebody they may not know in a bar, a restaurant, or some other place where they've spent some time in close contact.
So we're still focusing our goal, and we're now using text to reach out so that everybody who has a lab confirmed positive then gets at least one contact from public health. And we haven't been able to do it always, but our goal is to do that within 24 hours. And part of why we're reconfiguring some of our work is so we can make sure that as much as possible, people get at least that one contact within 24 hours. We collect some information at the time around exposures as part of it, and then we would do notifications on that. But I also think that it's now is the time for Nova Scotians to think that there's a high likelihood that they might have been exposed. If you're out and about, if you're in close contact with, especially indoors without masks being worn, lots of other people, then there's a high possibility of being exposed. So that's one of the reasons we need everybody to slow themselves down, reduce their close contacts, make sure they're masking and all those other pieces to minimize the chance of exposures, especially exposures when there's large numbers of people involved.
Go ahead, John, with your follow-up.
Dr. Strang, you've said a number of times at recent COVID updates that really it's the epidemiology that drives your decisions. I'm assuming it's the same for other provinces, but other provinces have moved quicker to provide boosters for those under the age of 60 and boosters for those for young people. So how do you explain why we're doing things the way we are and other provinces are doing things the way they are, given we seem to be epidemiologically speaking in the same boat?
So I think, I follow the science. I can't answer to why other provinces make decisions. They weigh up factors. But here's what we do know, that despite some of the commentators out there who would suggest that unless you have a booster dose, you have no protection against Omicron, I don't believe that. we still know that having 2 doses of vaccine gives you some protection, especially against severe disease, and so that's important. And then what we also need to know is that everybody will get an opportunity, but like we did with in our first 2 doses, our whole vaccine program has always been based on who is most vulnerable, who is at highest risk of severe disease, and they get to go to the front of the line. And we will move through that as quickly as we can, and then get to the next group. So right now, those most vulnerable are those who, because of age, are more likely to have waning immunity and therefore more likely to be need the protection of a booster dose. Those who are immune compromised and need a 3rd dose in their primary series, and we still need to make sure we have capacity and are focusing on the 5 to 11-year-olds. Those are our priorities. We expect that in early to mid-January, we'll be able to start those who are now 50 to 59. We'll be able to start making appointments, and as we move through those groups, then we'll move to the lower age groups. But I'm very comfortable saying that if you're 30 years old and you've got 2 doses of vaccine, your risk of getting severe disease is low, and therefore I'm going to make the decision to prioritize that the vaccine goes to those who are at greater risk of severe disease. We will get to you, but it's about prioritizing who needs to be made to get it first, and then everybody else will get an opportunity as we roll things out. Other provinces are having different approaches, but we had the same concerns when we started to roll out our program, and if you look at how we got through age groups and ended up with very high vaccination rate, our approach worked. Many other provinces, even though they made an announcement, people have lots of challenges of actually getting appointments. So when at the end of the day, we may well be in a place where if you're 30 to 40, you'll actually get your vaccine quicker than another province who may have already announced you're eligible already.
Next, we'll go to Callum Smith from Global. Go ahead, Callum.
Thank you. Dr. Strang, you've said Nova Scotia will continue to follow NACI's guidance on boosters, and you just alluded to prioritizing the vulnerable groups, but I wonder what timeline we could expect as to when we do open up and have the supply for 18 plus, especially given the transmission of Omicron.
So as I said, we expect, based on both capacity and supply, that early to mid-January will be of those 50 to 59 will then start to be able to make their appointments. And again, depending on how much, what uptake is and other things, then we'll give them a reasonable chance, and then we'd go to the next age cohort and the next age cohort. It's not that we're saying you won't get vaccine, but it's, again, prioritizing and moving through in a sequential manner, and that approach paid off and showed its success in the first couple of waves, so I don't see any reason why we would move away from that today.
Go ahead, Callum, with your follow-up.
What types of symptoms are people who are fully vaccinated presenting, and how severe are they with Omicron? I understand there's only a few hospitalizations, but can you elaborate on the types of illness people are experiencing?
Yeah, there's a range of people, some people asymptomatic and they're still testing positive, to people with, especially in kids, may have the sniffles or something. But a number of people, by reports, they're having what they call a flu-like illness. You may have several days of a fever, headache, aches and pains, cough. It's not pleasant, but when we say severe, and it means that you're not sick enough to end up in the hospital. Doesn't mean that we can just dismiss that illness, as well as what the Premier has said before about the mental health impacts and what the consequences of having COVID are to those around you who then have to isolate as well. We're not being dismissive of this, but we're also saying that we have to focus on less on the total number of cases and more on, are we controlling things enough and limiting the severe illness, and so that it's about protecting those who are at greatest risk for severe illness, as well as protecting our healthcare system.
Next, we'll go to Danielle Edwards from the Canadian Press. Go ahead, Danielle.
Hi, this question is for Dr. Strang. I know that the Queen Elizabeth II Hospital is moving back some of the non-urgent surgeries because of staff who may have been exposed to COVID-19. I was wondering if the province is looking at reducing the isolation time if a staff member happens to get happens to test positive for COVID-19 so that there isn't sort of a dearth of staff members for hospitals, or will they remain having to isolate for the full 2 weeks?
No, we're not asking them to isolate for the full 2 weeks. If people are fully vaccinated, which the vast majority of healthcare workers are, they have to isolate for 72 hours and then have a negative test. But and we want to maintain that standard if possible. The health authorities do have protocols. We call them work isolation, where if there's critical shortages, that healthcare workers can come to work. If they're still in an isolation period and asymptomatic, make sure they have rapid testing, before they start their shift, and extra precautions around PPE and masking and things. But we only use those where there's critical shortages. It's important that as much as possible we follow the procedures that are in place to minimize the chance of a healthcare worker being infectious when they're at work.
Go ahead, Danielle, with your follow-up.
Yes, so this is for the Premier. Just to slightly change tracks here, what do you make of the legal claims by Northern Pulp that the province owes it $500 million, and that it conspired to stop it from meeting a January 30th deadline for a new effluent treatment plant?
I've been very vocal on this in the past. I've always, as much as the company wanted to enter settlement discussions with the province, I always we said no to that and said if they had a case to bring, they should bring it before the courts. They've now decided that they have a court case to bring, and they brought it before the courts, and we'll let the courts decide on that.
Next, we'll go to Paul Bacon from All Nova Scotia. Go ahead, Paul.
Hello, Premier. The business grant you announced earlier, that money is coming from the unspent fund that's administered by Dow that was set up by the previous government. Is that correct?
Yeah, that's correct. There's somewhere in the range of $10 million at Dalhousie. We never closed off any of those programs. That money was still there, and that's the money. We'll use that to start. If we need more, we'll put more there. We're going to be there to support the businesses as much as we can.
Go ahead, Paul, with your follow-up.
And Dr. Strang, you mentioned earlier that we will lower the age eligibility for boosters as soon as we can. Is the holdup not enough people to administer the shots, or is it vaccine supply, or something else?
No, I mean, we're maximizing our capacity. It's really about making sure that each age cohort gets a reasonable time to get immunized, and we're starting with those who are at greatest risk. We're at 60 plus, which is a big chunk of our population, and we're those who are immune compromised, and we're doing 5 to 11-year-olds. So we're still immunizing lots of people, and we'll get to the younger age groups as sequentially as we move through time and have the ability in our system. But we have lots of capacity to immunize people, and we have lots of vaccine.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, many people were expecting a further tightening of restrictions given the case spike, such as perhaps reducing the maximum number of people at a household gathering, which is now 20. Why wasn't this done?
So we only put measures in that come into effect today. Every layer of restrictions has their own set of impacts. So as I said, we believe we have the right balance for today. It'll take us about a week to see the impact of that. And what's one of the key important things is that we need Nova Scotians to buy into this and everybody to slow down. It doesn't take restrictions, us restricting things to get everybody to slow down. But we're going to be patient. We'll watch things carefully. As I said, it'll take about a week to see the impact of our restrictions. But always, we are continue to assess things in terms of our hospitalizations, other impacts from staffing on the healthcare system on a daily basis. We have conversations with the Premier's office on a daily basis, and if we need to, make further changes, we will do those. But I don't, again, this is about a balance. We've set a path in place. We have to have a little bit of patience to see what is the impact of what came into effect at 9 o'clock this morning.
Go ahead, John, with your follow-up.
Thank you, and this is again for Dr. Strang. The rate of full vaccination, 2 doses, has been stuck in the 82% range for a while. Can we assume that's going to be it in terms of the vaccination level in the province? And given the contagiousness of the Omicron variant, is that a concern?
Well, I'd like to get it as high as possible, and that I think there's always going to be a small proportion of the population which is not going to get vaccinated, and we believe that maybe around 5%. We're getting close, which would mean that for those who are eligible, that we should, we 95% of us should be immunized, and we're getting up there. Today we're at 82.4%, and I'm hearing anecdotally that with concerns about Omicron and other things, we're still getting people coming forward to start their vaccination series. But that last few percent, every percent is 10,000 people. So that's not going to move very far or very fast. But we're leading, along with a couple of our Atlantic provinces, colleagues. We are leading the country in our vaccination rate, and I think we have to trust that not that we can rest and not continue to vaccinate, but what we've done and the work the Nova Scotians have done to get to that high level of vaccination is going to have a substantive positive impact in limiting the severity of this Omicron wave.
Just on that as well, I think it's important to note that as much as we're in the 82% range, we still have about 10% of our population that is under 11 years old. A great majority of them are getting vaccinated. We're pretty encouraged by the vaccination rates that are happening there, but none of them are second dose yet. They're all first dose and they're in that. So once we get them through the second dose, you should see that percentage jump into the range that Dr. Strang is talking about. So I don't want that to be lost either.
Next, we'll go to Eloise Rodriguez-Kisibash from Radio-Canada. Go ahead, Eloise.
Hi, Dr. Strang. We're seeing numbers that we've never seen before. Seeing how fast the spread is, do you suspect that most of these cases are Omicron? And how many samples have you sent off to identify if it is this variant?
So I don't have a number. We continue to send isolates off to the national lab, and we're also working at developing our own capacity to get the confirmatory tests here locally. We do know that of the initial ones sent off, some were Omicron, some were Delta. But if we look around the world, we fully expect that a growing proportion of our cases are going to be in the Omicron strain in the days ahead.
Go ahead, Eloise, with your follow-up.
Thank you. So I'm hearing a lot of frustration among Nova Scotians because there's been over 1,000 cases this week, and yet the number of people in hospitals is quite low. So if you're not basing yourself on hospital capacity to put in these restrictions, can you explain to these people what you're basing yourself on?
So as I said, we can't just there's too many unknowns, and then we can't just sit back and let Omicron spread unchecked. So we put what is a balanced approach of going back to phase 4 restrictions, which are a significant reduction in how people move about and especially their social activities, all of which have major impacts. So we don't do that lightly, and we're not going to do that unnecessarily. But we have to slow things down, and we can't just let Omicron spread unchecked because of the uncertainties. And that's why we continue to watch very carefully where we're at in terms of the whole goal of doing this is to start to have an impact on slowing down the spread and starting to see over the next week or so the case numbers at least plateauing, and that's where we need the help of all Nova Scotians. Again, all of us need to slow down and be more cautious and careful about our social contacts. But again, if we did nothing, we put too much of a risk of putting those who are vulnerable at risk and putting our healthcare system at risk. So we're taking this balanced approach, and we'll adjust as necessary.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. Good afternoon. This morning, the New York Times reported that the AstraZeneca vaccine is essentially close to worthless in terms of dealing with the Omicron variant. There's an awful lot of people out there, including myself, who got one shot of AstraZeneca and one mRNA vaccine. We're not in any position now to get a booster shot, which would effectively just be two vaccines that work against Omicron. Should there be a new approach for people who got 1 or 2 doses of AstraZeneca?
No, my understanding of the evidence is that you got what's called a mixed schedule, that you get very good protection. And in some people, some of the experts would say you have the best protection because the type of protection, immunity you get from the viral vector, AstraZeneca or Johnson & Johnson vaccines is slightly different from what you get from an mRNA vaccine. Well, I think that I haven't seen the evidence or the paper you're talking about, but I think it's people who were only had a viral vector vaccine. And the majority, we have some, but the majority of Nova Scotians have had mRNA vaccine, or at least had the mixed schedule that we believe are comfortable that there is still good protection, especially against severe disease from either those mixed schedules or 2 doses of mRNA vaccine.
Go ahead, Tim, with your follow-up.
Yes, I wonder if you could speak about the COVID notification app. We all kind of got rid of it because there was so little COVID in the province, and it was eating up our phone batteries. Should we all reinstall that and make use of it? It's curious that no one's even mentioning it.
So that was a federal initiative, and I haven't. I mean, a lot of that depends on how effective it is and useful it is. Depends on the uptake, and I to be honest, I haven't heard anything from the federal government about that notification for quite a while.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question's for Dr. Strang. Realizing this has been going on for almost 2 years, realistically, what is the benchmark for us to learn to live with COVID?
Well, I think, right now we're faced with another challenge because of the variant with a lot of unknowns. But it's, the hope, and I think there's a lot of people would say that we get through the Omicron wave over the coming weeks, and we continue to use vaccine to, whether it's 2 doses or 3 doses where necessary, that we get, I think one of the key things is getting those 5 to 11 and even under 5 fully immunized. That puts us in a much better position with high levels of immunity to then really make the transition to moving away from a pandemic response and having to use mandatory kind of restrictions and measures, but we're not there yet.
Go ahead, Pat, with your follow-up.
The follow-up is for both Premier Houston and Dr. Strang. I've talked to a lot of people. They're exhausted from all of this during the past 21 months. They saw the light at the end of the tunnel. Now, the last couple of weeks, and even the last few days, it seems the light is further away. If Nova Scotians are feeling exhausted, how are each of you and your teams doing as the case numbers surge?
Well, I'll be honest, I'm tired too, and I get it why people are disappointed. We thought we were here, getting here in the fall, and then now we thought we were getting here in Christmas, but the pandemic isn't kind, but we still have to respond, and I have teams of people and people across the healthcare system that are exhausted. That is why we all have to dig deep, but people have to understand how hard my colleagues in government and healthcare system have worked for the last 2 years almost, and that's what we need everybody to dig deep now, and we need all Nova Scotians to do what they can just to support my colleagues who have been working to take care of you for the last 2 years.
Thank you, Pat, for that important question. I think all Nova Scotians are definitely exhausted by it, but I'm particularly concerned about our healthcare workers and the folks at public health and their families, who are, it's constantly on the mind. Were they exposed? Are they safe? Are they able to keep their colleagues safe? So it's been a long run for everyone. And you're right, that light does seem a little further ahead, a little further away at the moment, and it is a little further away, but it's still there. And we just keep going forward. We deal with what's in front of us, and that's what makes us Blue Nosers. We put our head down and get to work, and that we'll get through this.
Next, we'll go to Lindsay Armstrong from the Coast. Go ahead, Lindsay.
Thank you very much. Dr. Strang, what is your advice for Nova Scotians who are planning travel within Canada for the holidays?
So I would say people have travel plans, slow down. stick close to home, even within the province. If we're really going to focus on having small social numbers, we should all be thinking, well, how many people even we're going to have for our Christmas dinner? How many social events are you going to go to? And you have to think about, is that travel really necessary at this time of the year? It's an obligation of all of us to make really safe choices for ourselves, for our families, and for our fellow Nova Scotians.
Just a reminder, if you've just joined us, please ensure your lines are on mute if you're not speaking. Go ahead, Lindsay, with your follow-up.
Thank you. Thank you very much for that. I'm wondering if you were looking at border restrictions or isolation requirements at the borders, given the boost of cases Canada-wide.
Well, we already have, restrictions that if people are coming in here, they're not fully vaccinated, they have to isolate and be tested before they can come out of that isolation. The reality is that Omicron is here and it's spreading within Nova Scotia. So right now, I don't see much of a value add to tightening down our borders. But if we have to go further and look at further restrictions, we would certainly be looking at the border along with other things that as what is the value of tightening those down. But I don't see that at this point in time.
Next, we'll go to Lois Ann Dort from the Guysborough Journal. Go ahead.
Yes, hello, good afternoon. Thank you for taking my question. I'd like to ask, how many rapid tests does the province have to distribute, and will they be funneled toward areas with an outbreak, such as the Antigonish-Guysborough Community Health Network?
So I don't have a number in front of me of a number of test kits. We've had a significant supply, but we're going through it rapidly. We're certainly looking at different ways, whether with the federal government or ourselves as the province, procuring more test kits. And as I said, I have teams of people actively looking at and bringing forward to me recommendations in the next few days about how we prioritize and how we use both our lab PCR testing and our rapid testing. And we will have more to say on the specifics of that by middle of next week.
Go ahead, Lois Ann, on your follow-up.
Okay, thank you. If we don't currently have the staff to do contact tracing as we did in the past, why weren't schools closed earlier and customer limits reinstated in businesses like grocery stores, particularly in outbreak areas such as in the Antigonish-Guysborough Community Health Network?
So it's always about balance. All of the measures you say, closing schools, as we know, we've learned the last 2 years, closing schools has a significant impact on young people, not just their learning, but their social, emotional development, has impacts upon families. So every restriction has its own set of impacts. So we always work to, as I said on Monday, always trying to find the least amount of restrictions necessary, and when you do apply them, you use them for the shortest period of time possible. But things have changed quickly. So what was appropriate and necessary this week is different from what was appropriate and necessary even last week.
Next, we'll go to Drake Lowthers from the Port Hawkesbury Reporter. Go ahead, Drake.
I was just wondering what the most concerning thing we've realized or discovered coming from the recent outbreak here in Antigonish.
I didn't catch the first part of your question.
Just what was the most concerning thing that we've discovered coming from this most recent outbreak in Antigonish?
Well, I think it's really understanding that that in the confirmation that we know from other places that how infectious and how easily spread the Omicron variant is and how quickly that expanded.
Go ahead, Drake, with your follow-up.
And does the province have a handle on how the virus spreading outside of the St. FX and Antigonish outbreak?
So I think what we understand, there was a lot of people were from the Halifax area and other parts of the province were in Antigonish for that weekend. We have lots of ex-grads throughout the province, and it's an important event for them. And so there's lots of movement of people, and the virus moves with people, and now especially in the Halifax area. And from there, it started because it's so highly infectious. It started to spread. It spread from there.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Thank you, Dr. Strang. It's not supposed to feel like this on the Friday before Christmas, but as we enter the holiday season, remember, slow down. 20 is plenty. I wish everyone a happy, safe, and slow holiday season, and encourage you to make the most of it under the circumstances. Whatever comes in 2022, with the strong guidance of Dr. Strang and his team at Public Health and the amazing commitment of Nova Scotians, I know we can handle it. Thank you.